Good day, everyone. Our presentation is about the pandemic response for Nexovirus. Our goal is to show clear strategies for prevention, control, and vaccination. The Nexovirus is a respiratory and neurological virus. It infects the lungs and nerves that causes breathing problems and mild nerve inflammation. The virus came from a zoonotic spillover in places where humans and animals are in close contact, such as farms and wildlife markets. It spreads through droplets from coughing or sneezing and survives on surfaces for up to 48 hours. Early symptoms include sore throat, dry cough, and fatigue. Severe cases lead to shortness of breath, dizziness, and loss of smell. Our plan connects biotechnology, healthcare technology, and ethics to manage the virus and protect communities.
So, in the first weeks of COVID 19 infection, we only have one reliable test, which is the PCR test. The polymerase chain reaction test is a way to look for genetic material, whether DNA or RNA, from a deep nose swab. Mucus is then collected and suspended in a solution, which determines whether someone has the virus or not. It is a cheap and highly repeatable method. However, it sports a false positive error rate of approximately 2.6% to 16.7%, therefore being slightly unreliable. False negatives were also reported from samples taken too early in the infection. But with the advancements of biotechnology, we now have what is called the CRISPR-Cas. It is a gene editing tool derived from a bacteria's natural editing mechanism for defense, modified to make precise changes to DNA sequences. It consists of an RNA sequence that serves as a guide, while the protein acts like a scissor to cut a specified DNA sequence to replace it with a desired sequence. Initially used in treating sickle cell anemia, CRISPR-Cas technology brings promises to diagnose accurately and to treat infectious diseases such as viral and bacterial diseases. In this regard, several studies have shown the potential of CRISPR-Cas technology in the treatment and diagnosis of viral infections like HIV, hepatitis, and other infections, and other bacterial infections like E. coli infections.
Biotechnology helps make vaccines and medicines faster using advanced tools. Scientists can study germs and viruses quickly through genetic engineering. They can design vaccines using DNA or RNA to help the body fight diseases. Computers help test how safe and effective new vaccines might be. Lab robots can make testing and production faster. These methods allow vaccines to be produced in large amounts. Because of this, people around the world can get vaccines and medicines more quickly.
With the power of artificial intelligence, we will be able to gather vast amounts of datasets in a very short amount of time. An example of this is called Blue Dot, which is a Canadian AI platform. It flagged a sudden surge of pneumonia cases in Wuhan on the 31st of December 2019, 9 days before the WHO's formal announcement. Another way AI can help is through intervention forecasting. Reinforcement learning models can evaluate optimal policies, such as the balance between lockdown intensity to the predicted economic loss of said lockdown. And one more way is through automatic information dissemination. AI can automatically text individuals regarding policy changes and new government health mandates to ensure that everybody is updated.
Telemedicine and mobile health apps allows doctors to check on patients without meeting them in person. Patients can use their phones or devices to send health data like blood pressure or sugar levels. This helps doctors track their condition and give advice anytime, anywhere. It also helps patients get faster without waiting in hospitals. Because of this, hospitals become less crowded and can focus on serious cases. Telemedicine also saves time and travel costs for patients.
Using technology for effective communication while combating public health misinformation can be achieved by improving communication channels and partnering with trusted local groups. Verified social media accounts, official websites, and targeted SMS messages enable the safe and accurate sharing of reliable information. For example, during the COVID-19 pandemic, trusted health authorities used social media and SMS campaigns to quickly and effectively communicate safety guidelines and vaccination updates. Strategic partnerships with media outlets also helped limit misinformation by spreading verified public health updates and also training community health workers to lead local awareness programs ensures that information remains consistent, transparent, and culturally appropriate. These workers can adopt messages for their communities, answer questions, and build trust. This further support public health goals. Now, these strategies utilize technological and social resources all at once to enhance the effectiveness of communication in public health and combat misinformation. Ethical concerns of fairness and equality are brought about by the meeting of biotechnology, health innovation, and public health technology during a pandemic. One of these concerns is unequal access to testing, vaccination, and healthcare services, especially between city and rural areas. During the pandemic, rural communities are greatly affected because they have fewer health facilities and face delays in COVID-19 testing and vaccinations. This problem calls for the fair sharing of health resources and the use of mobile clinics to meet the needs of these communities. False information adds to vaccines doubt and mistrust. The harmful use of technology should be stopped by giving regular, real-time, and culturally suitable information through these platforms. For the sake of fairness, the sharing of limited medical supplies and vaccines should be free from supply chain problems to prevent unfairness that favors the rich and city areas. Rules to encourage vaccination, however, should still respect individual freedom.